Hello and good morning. My name is Peter Hugh, the current president of NAACLS. In my other role, I'm the current dean at interim for the School of Health Professions at the University of Texas MD Anderson Cancer Center. Each year, NAACLS provides an update at the CLEC showcasing various highlights, initiatives, and information regarding our accredited and approved programs. For those of you who are new to this presentation, we typically begin with our mission and vision statements. Our mission, the National Accrediting Agency for Clinical Laboratory Sciences, is committed to being the premier agency for international accreditation and approval of educational programs in the clinical laboratory sciences and related healthcare disciplines. Our mission, medical laboratory preferentially seek graduates of NAACLS programs to assure quality, value, innovation, and safety for healthcare consumers. And our value centers around quality, education, innovation, collaboration, peer review, and global accreditation. The structure centers around its board of directors, which is made up of individuals from sponsoring and participating organizations. The board is supported by two groups of people. There is the volunteer side, made up of review committees, and there are also the paid employees, led by the CEO, Dr. Diane Clearlock. The board of directors composition is made up of representatives listed on this slide. These are all volunteers. And as for the review committees, they are made up of the RCAP, PARC, and DRC. These are also volunteer positions. This past year, due to the pandemic, many organizations, including NAACLS, had to think outside the box and come up with innovative ways to maintain our day-to-day operations. We couldn't have done this without our extraordinary volunteers and staff, from implementing and learning new platforms for virtual meeting to virtual site visits. We were able to continue and quickly adapted to the new norm. And as such, NAACLS welcome any new volunteer opportunities. It is our hope that in the near future, we'll return to face-to-face site visits and recruit new volunteers and learn from these experiences. In order to achieve that, we will need our existing volunteers to help us train the next generation of volunteers. Currently, we are seeking nominations for a 4-year educator for RCAP and a phlebotomy educator for PARC. If you would like more information regarding these positions, please contact NAACLS staff or visit nominations@naacls.org or find us at our virtual booth. Self-nominations are encouraged and the deadline has been extended to March 15th. On the other side of the equation, and our NAACLS staff is headed by Diane Clearlock. Her and her team have been working with many of you behind the scenes via emails or phone and are always eager to help and to provide the best experiences possible. During last year's CLEC update, the BOC announced that they will no longer report sub-test scores to people who passed the exam. Many of you contacted NAACLS to see if that would impede on one or more of the standards, specifically with standards 2B1 and 4. NAACLS is aware that programs often use the sub-test scores in program assessments, and BOC has since confirmed that this information will remain available to program directors, and thus we concluded that BOC policy would not prevent programs from reaching full compliance with any of the NAACLS standards. If you have any more questions, please feel free to contact the NAACLS staff. Now let's take a look at some of the other specifics. First, from the annual survey. Our preliminary results show that there have been some increases, slight increases in terms of class size, faculty resources, and also change in budget, which is a good thing. We did, however, see a slight decrease in the clinical placements, and that is understandable due to the pandemic that's occurred in 2020 and currently ongoing. In this slide, we're looking at the total number of graduates versus programs. As you can see, our numbers for 2020 is fairly similar to that of 2017. We have seen a little slight dip between 18 and 19, but that can be expected, again, also due to the pandemic. With respect to program turnover, in 2020, we had a slight drop in the total number of programs, which is expected as many programs face challenges from the ongoing pandemic. In addition, the number of new program directors is still increasing, totally a near 50% turnover in the past 4 years, which means that we will need to have more workshops and more volunteers, experienced volunteers, or VIP mentoring programs to train the new generation of program directors. With respect to our current projects, our doctoral candidacy status, NAACLS is thrilled to announce that 2 programs are currently in candidate status for doctoral accreditation. Doctoral candidacy status means that it is a pre-accreditation status comparable to serious applicant status. With respect to our strategic plan, the Board of Directors continues to develop and refine our strategic plan. The plan will focus on 5 of the following targets: promote program excellence and innovation, promote and market the value of NAACLS accreditation and approval, maintain and improve quality accreditation services, support and enhance the professional development of staff, volunteers, and program personnel, and maintain a stable financial position to achieve NAACLS mission. CHIA and its transparency. As you may or may not know, NAACLS recognition agency, the Council for Higher Education and Accreditation, CHIAS, is committed to holding accreditors accountable for the accessibility of any information which contribute to informed decision-making by the public at large. They have gone to a more outcome-based evaluations. These tools that aid in informed decision-making by the public includes the program award status and educational programs availability of outcomes. So NAACLS is monitoring these evolving requirements and will change our policies or standards when appropriate. With respect to AMT and the benchmarks, at the September meeting, the board of directors approved the inclusion of the AMT's MT and MLT examination results for accredited programs and benchmarking. The NAACLS Review Committee, RCAP, has been asked to work with the board of directors to develop an implementation plan for this policy. Further details will be available on the NAACLS News once we finalize. And finally, it is with bittersweet for me to announce that Dr. Diane Clairlock has notified NAACLS Board of Directors of her intentions to retire in the summer of 2022. NAACLS will officially begin a search in June of 2021. Further information will be made available in the coming months. And that concludes my updates for today. Enjoy the rest of the meeting.